What's the difference between physiotherapists, osteopaths, and chiropractors? We asked 3 practitioners, and each showed us how they examine lower back pain. Physiotherapists use a combination of manual therapy, massage, stretches, exercises, and advice designed to treat a range of musculoskeletal injuries, including back pain. Dave starts by asking a set of medical questions to establish how the pain has occurred and what the aggravating triggers are. He then begins his assessment by observing the foot, ankle, and spinal areas, and includes a hands-on assessment of the lower back where the spine meets the pelvis, while observing the side-to-side movement of the spine. Using the stalk test, he sees how single-leg balance is controlled for lumbopelvic stability. Then, lying the patient down, he will manipulate the painful and dysfunctional areas to pinpoint the affected area. Dave's treatment would then include manual therapy techniques such as massage, exercises, strapping, or acupuncture. Osteopaths use a hands-on approach, involving skilled manipulation of the spine and joints and massage of soft tissues. Lisa also starts by understanding the patient's unique set of symptoms through questioning. This helps her to understand the patient from a holistic perspective, rather than just considering symptoms in isolation. Lisa's assessment starts specifically with the feet, and she works upwards to knee joint positions. Then, looking at pelvic alignment to identifying any lack of symmetry, to assessing spinal curves and identifying areas of postural strain. She will then finish by assessing neck tension, feeling individual parts of the spine. Then, Lisa will move on to observing the overall standing posture and how the spine actively moves in various degrees of motion. Also lying the patient down, Lisa will focus her assessment on the individual movements occurring in the spine. After treatment, she would give the patient stretch and strengthening exercises to help in their recovery. Chiropractors use a range of techniques, from specific manipulation, mobilization, massage, and muscle release to improve the movement and function of the spine and other joints. Alan also starts with taking a full medical history and will include many specific health and lifestyle questions, plus an observation on how the body is moving that then leads to a hands-on approach that will specifically challenge the joints. He starts with observing the walking gait, looking for what's moving, what's not, what might be causing the problems. Then we'll move on to assess the backward bends at the lower part of the spine, then the forward bend, to look for a possible restriction and pain point. He will then support the patient to restrict part of the movement that stresses the spine, again to identify the problem further, and look for normal spinal movement through side-to-side bending. Alan will also lay the patient down, but push into the joint using straight leg raises to check for any nerve damage that may be caused by disc problems or similar. Then, he will move the hip into various positions, feeling and challenging directly if this area is the problem. Alan's treatment would commonly consist of challenging and getting movement into the joints. After treatment, he would encourage the patient to get back to full exercise and activity.